Hello and welcome to Top Secret TV. My name's David Becker. On tonight's show we speak with Nicole Belsma. Nicole is a naturopath, acupuncturist and massage person, and she's now moved into traditional Chinese medicine. Welcome, Nicole.
Thank you.
So can you tell us a little bit about what traditional Chinese medicine, or TCM, is?
Okay, TCM encompasses a wide variety of modalities, from things like acupuncture, which most people know it as, also things like herbal medicine and things like cupping, so the use of cups like this, used mainly in things like Chinese massage, etc. Moxa is also commonly used with a Chinese massage and Chinese medicine, things like this.
Yeah.
Yep.
Just going back to cupping, how do you use the cups?
Cups, yeah. It was actually produced many centuries ago by martial artists, because what they found is in order to do their training, they had to get rid of the bruises very quickly to get back into training. So they developed cupping therapy as a way of getting rid of bruises much more quickly and stimulating the healing process.
And is that where you actually put a flaming substance in the thing and it sucks, creates a suction? Is that how it works?
Absolutely, yeah. So what you do is you normally, what I'll do is I'll dip that in metho, then put a flame to it, put it under the cup, take it out and quickly put it onto the areas such as the thigh, the back, the neck, or wherever. Yeah.
And it's mainly used for getting rid of bruises?
Bruises primarily, sprains and strains. Could also be used for things like a common cold, coming down with cold and flu symptoms. It's very useful for that as well.
Okay.
Yeah.
All right, and what was the other thing, Moxa?
Moxa, yes. Moxa is a form of heat therapy used for many centuries in traditional Chinese medicine, basically used for conditions due to cold in the body. So things like musculoskeletal pain that's aggravated by cold, rainy weather.
Arthritis?
Yes, arthritis, yep. But there's different types of arthritis in traditional Chinese medicine. You can have a hot type of arthritis or a cold type. So a cold type would respond very well to moxibustion. Moxa comes in different forms, from a stick like this, a moxa stick, to moxa punk, just this form here. And moxa punk is really just the raw form of mugwort. And basically the way you'd use it is to put into a moxa box, like this, to put in a moxa box, and then place it over the area that's required. So for example...
And burn?
Yes, and burn it. What I do is get an incense stick, attach it to different parts on the moxa, then put the lid on, make sure there's some oxygen into that area, and put it either on the lower back for lower back pain, or on the lower abdomen for period pains or something like that. Yeah.
And I was saying before the show that comparing it to Tiger Balm, and you said it's actually hotter than that, or can be.
Yeah, in fact it's probably the hottest form of heat treatment you can get on the market from any other modalities. What I found is using Moxa is it actually goes deep into the bones, as compared with, say, liniments, where you put them on the skin. It gets the skin hot and you might feel numbness and tingling, but that's as far as it tends to get. With the Moxa, it actually goes into the channel. As you know, in Chinese medicine they see the body in terms of energy in channels, into the channel, and it often travels. So some points on the body, acupuncture points, say in the lower back, you can put the stick at, say, an inch above the skin, and you'd feel the heat moving down into the channel, and sometimes all the way down to the little toe.
Wow,
yeah,
that's amazing. How long has traditional Chinese medicine been going in Australia?
It's been going on since early this century, basically when the Chinese came out as a result of the gold rush. That's when it became more popular, but it really wasn't until the last 10 years or so that it's really increased in popularity. I guess mainly because of education, but certainly because of the influx of more Asian people into the country, and people wanting to seek alternatives with their medical care.
I understand you actually have some statistics to do with the way it's increased.
Yep.
Can you perhaps run us through some of those?
Yeah, sure. In December of '95, the Victorian Department of Human Services commissioned a report. Now this report was mainly done in the University of Western Sydney, and it was called Towards a Safer Choice. Now in this particular report, what they discovered was about 2.8 million consultations on traditional Chinese medicine alone occurred last year in Australia.
That's amazing.
It is, yeah. That works out to about $84 million annual revenue on that alone.
How does that compare to other countries? I mean, are we a world leader in uptaking of a complementary medicine, or?
I think so. In fact, I remember reading another report, I'm not sure what report that was, a couple of years ago, that Australians, for their population size, we seek more complementary therapists than any other nation in the world. Yeah.
Well, that's really good. Now, another thing that we were talking about earlier is in '92 you went to China to have a look at how they did things, and you're saying that the way Chinese medicine is handled over there as part of an integrated approach is quite different to here. Can you tell us a bit about that?
Sure. It was an experience going to China, very different to the West. In terms of the hospital system, I found that hygiene isn't a big priority in the hospital there, which was a bit of a shock because it's, you know, hygiene is such an important part of Western medicine. In terms of the hospitals, we were mainly treating, they have several departments in the hospitals ranging from traditional Chinese medicine, acupuncture, massage, which is nice to see in a hospital setting, and also traditional Western medicine. So they complement one another. Now, they refer often to one another because of the fact that in both of their training they need to learn the other system. So for example, to become a Western trained doctor in China, you need to do a year of traditional Chinese medicine.
Really?
Yeah. So it was very common to refer from one department to the other. In terms of acupuncture though, I found when we were there we were mainly treating post-stroke patients, so people who had strokes, and within the next day we would be putting in needles in twice a day for up to 3 weeks in a row, treating them for their paralysis in order to minimise that.
And how did that, or how would that compare with the Western medicine approach?
Well, Western medicine really can't offer much when it comes to post-stroke symptoms. So I guess over many hundreds of years they discovered in China that that was the most therapeutic way to go in terms of treating those sort of patients. Yeah.
What's the underlying philosophy with traditional Chinese medicine?
It's very different to that of Western medicine. Western medicine is more based on science, the scientific principle. Chinese medicine is based on Taoism, which is so remotely different to science that the philosophy of health and healing is very different. And I mean, that's understandable because you're talking about a country that was so isolated from the West for so many centuries that it had time to develop its own concept of health and disease. Now, Taoism, the philosophy of Taoism is based on energy, that everything is made up of energy that vibrates at different frequencies. Ironically now, with quantum mechanics and the scientific principle, they're discovering this, you know, through a huge cycle, that in fact, yes, that atoms and molecules are actually made up of energy vibrating at different frequencies.
Just a bit of an aside, with the isolation of China from the rest of the world during that time, and then when there was contact with the great influx of opium, has opium found its way into the traditional Chinese medicine system?
I haven't actually seen that in terms of the pharmacology of Chinese herbs. And also, I mean, being in Australia, there would be banned,
obviously,
so,
yeah,
you know, we don't tend
But
to see.
you didn't see it when you were over there?
No, not at all.
Okay. Now, another aspect of Taoism that we touched on briefly is the idea of cycles. How do cycles impact on people?
Yep. In Chinese medicine, it's a normal part of their philosophy. So, for example, the way in which the person reacts with their environment is well understood in Chinese medicine, from moon phases to seasonal changes, etc. Everything is cyclical, and that's why you have the yin-yang symbol as being a circle, because that represents the cycle of nature. Also, with the yin-yang symbol, you have the black and the white dot in the black, indicating yin within yang and yang within yin. But basically, the seasons have a huge impact on our own energy cycles. So, for example, in winter, where it tends to be cold, we need to have and drink and eat more warming foods in order to counteract the coldness in the environment. Yeah.
There's been a great load of literature obviously written on the subject, and you've got a collection of books here tonight. Can you just run us through a couple of these and some of the better ones that perhaps if people want to follow this up?
Sure. One of the best books I found for the layperson who's not familiar with traditional Chinese medicine is Ted Kapchuk's book, Chinese Medicine, The Web That Has No Weaver. Excellent book for the lay person, yeah.
Okay.
It's a very poetic book, and in fact Chinese medicine is all written in poetry.
Really?
Yeah.
Does that make it more difficult to use? Or
it does actually, because in Western medicine 1 + 1 = 2. In Chinese medicine 1 + 1 could equal many different things, you know. Things aren't concrete. And in practice you find, even though it's frustrating learning it initially, once you're in practice you realise there's never any standard textbook case. So in fact I found it, for me, it prepared me far better in practice to deal with different people than it did, so my other bits of my training.
Would you say that that's perhaps a possible criticism of Western medicine, is that it tends to categorise and reductionism, I guess, so that people get treated a little bit the same and they might miss out on that individual care?
Absolutely, yep. And in fact, I find a good example of that would be, say, for patients who come in with asthma, who've been diagnosed with asthma. Now, asthma in Chinese medicine doesn't mean anything except difficulty in breathing. So that's one symptom. In Chinese medicine, you never diagnose from one symptom. So, for example, if you had a 4-year-old with asthma compared with, say, a 10-year-old male with asthma or a 22-year-old female with asthma and then a 45-year-old with asthma, once you take the entire case history, you'd find that they have very different symptoms. The 45-year-old might have gastrointestinal symptoms, abdominal pain, period pains, etc. The diagnosis would encompass that. Whereas with, say, the 4-year-old with asthma, the diagnosis will probably be very different. So in those 4 patients, you'd have diagnosis which would probably vary greatly between each of the people, and therefore be treated very differently. So it's very rare that you use the same diagnosis for a different type of Western medical condition.
Right, okay. Some of the more unusual, well, at least I guess from one perspective, more unusual diagnostic techniques is tongue. How can you tell something useful from a person's tongue?
Well, you can. It's just like what the iris is to the naturopath. Ear diagnosis, tongue diagnosis and pulse diagnosis is to a traditional Chinese medical practitioner.
Yeah, all right. Can I put you on the spot and give you a look at my tongue?
Okay.
All right.
First I look for the tongue body shape and the tongue body colour. There's lots of redness at the tip and also redness on the side. The coat is slightly thin and white, and there's a crack in the back. You can poke that back in. What that means is there's a lot of heat in the lung area. Obviously, I know you're a smoker, and that's aggravating that condition. Smoking always dries out the lung energy, makes you more susceptible to colds and flus, etc., because the lung's ability to fight off pathogens is reduced. Also, there's a bit of heat in the liver and gallbladder areas. Now, remember, when I talk about organs in Chinese medicine, they're not the same organs as what you would imagine liver and gallbladder are in Western medicine.
How do they differ? I don't understand.
Greatly. In fact, so much so that the Chinese never opened up a dead body or a cadaver in order to determine where the organs were. They found over many hundreds of years that they could determine problems with the body just by looking at the face, the shape, the colour of the skin and the lustre, and how that changed when someone became ill. The hair, lustre, the way they walked. If they were sick, they tend to be more emaciated or slower walking. Changes in their pulse and tongue would reflect disharmonies in the body.
So it's clearly a lot less invasive system.
Very, very much so. Yep, very much on observation skills and ability to determine changes, subtle changes in the body, rather than doing pathology tests and things like that.
Is there a synthesis between the two where you can use like modern electronic diagnostic tools in order to give a diagnosis that you can then give traditional solutions to?
I'm sure many practitioners do that. From a TCM perspective, it's a bit more difficult. It really depends a lot on your foundations in TCM, and also intuition plays a bit of a role too. I mean, how well you are at taking tongue diagnosis and pulse diagnosis is really a skill.
Right, yeah. We've got a couple of other things on the table here.
Yep.
Can you just take us through these? What are the blue and red and green boxes there?
Oh, okay, yes, acupuncture needles. These are an example of acupuncture needles we use in practice. They're different sizes.
One up and have a look?
Yeah, the blue one is the smallest needle, as you can see.
Right,
Right
yeah.
there, that's a
so
very
these are
small
hermetically
needle.
sealed for like
Oh, yeah.
against germs.
They're all disposable needles nowadays. So that's a small needle, you can see by the handle there. This is a larger needle in terms of the length, it's larger.
Yeah.
Also the diameter of the needle can vary from one needle to another depending on what the practitioner prefers to use.
Are these just used once?
Yes,
thrown
they're all
away?
disposables
Okay.
and thrown out. Yep. It's too risky now to sterilise needles, and it's
course.
very messy.
Yeah.
Yep.
Yeah. Can you use heat in conjunction? I've heard that you can actually attach burning things to needles in order to heat them up to create a kind of a treatment. Is that correct?
Very, very much so, yep. So what would be a combination of moxa with a needle?
Yeah.
If I just give an example, this is the largest needle you tend to use. You can see
That's humongous.
how long that is. That would go in someone's butt,
Okay.
basically, but not normally, you know, around the face.
Right, yeah,
or
the
the
tongue's
head.
about as far as I go, actually.
We don't put them in the tongue, but, you know, I could always try. I
Oh,
wouldn't
no,
mind
no,
trying
no.
once. Now, with moxa, what you do is you just get a bit of moxa punk, like this, and you attach it to the needle. and then you obviously insert the needle in first, and then put the moxa in, burn the moxa, put a little bit of paper around the needle so the ash doesn't fall on the person. And it's a very strong way of putting heat into the body.
Okay, directly straight into the nadia or point.
Channel, yeah.
Yeah.
Yeah,
Okay.
so that's commonly used too.
This might seem like a bit of a strange aside, but people who have body piercing done to them, could they actually possibly do permanent damage to themselves by putting it in an acupuncture point by mistake or whatever? Or even positive thing, like, you know, they can move their body piercing thing and then actually have a positive health benefit for them?
Yeah, well, I think particularly with ear piercing, it has a huge impact because there's a system of acupuncture in Chinese medicine that diagnoses solely from the ear. So, for example, different parts of the ear relate to the rest of the body, and that's why it's used a lot in as an alternative to anaesthetic drugs in China for surgery. So they'll attach a needle to that part of the ear that relates to the area that they're anaesthetising or doing surgery on, and then attach an electrode. So if they were piercing a part, normally they pierce the eye in a lot of women do in the middle lobe there. So that could have an impact on it, but the effect, the degree to which it has the impact on the ability to see, etc., will vary from individual to individual because that's only one factor and there's many factors that can affect vision.
At an extreme, what could it be? It could actually negatively affect their vision?
Yes, yeah, too much stimulation. Yeah, just like, for example, massage sandals, you know, the ones that they brought out 5 years ago. Geez, so painful to wear, weren't they? Yeah, overstimulation of all the reflex points on the feet. Yeah.
Really? And they can have a negative impact?
Absolutely. They often caused headaches, dizziness and fatigue.
That's
were really common with those sort of things. Too much stimulation. Yeah. So you need a balance. Moderation is the key.
Some of the other bits and pieces we've got here, what's the green sort of brush thing?
Okay, this is what I picked up in China in one of the departments called pointing therapy. Now this was in the massage department, which was very nice to see in a hospital. A lot of people were lining up for massage, not so many for acupuncture. But in China it's very important as a masseur, you not only train in Chinese medicine and do 5 or 6 years of that full time, you then have to train extra to become a masseur.
So it's comparable to Western medical degree?
Oh, absolutely. Masseurs in China are considered very high up in terms of their profession, absolutely. This is something they use particularly for themselves to look after themselves. It's very important to look after yourself as a practitioner first before you can look after other people. So they recognise that and they spend a lot of time Tai Chi, Qigong, etc. in order to do that before they can then help other people.
Is that in order that perhaps on one level so that they don't drain too much of their energy in helping other people?
Absolutely, yeah.
Because I heard a story once of a Reiki practitioner, a Reiki master, who was actually getting sicker and sicker because instead of grounding themselves and using, I don't know, the cosmic energy or whatever, they were actually using their own energy to heal, and it was like sucking them dry. Yeah,
and it's really common in practice. I think that's why there's such a huge burnout rate in complementary therapies. Certainly from my experience with my colleagues, less than 5% will be practicing after they graduate.
Really? Because it's just so draining.
Yeah.
That's amazing.
And I probably too do business skills. I mean, you know, you get out of the course and you've got to look around clinics, etc. You don't just get a job like that.
Yeah, and build up a practice.
Yeah. But this is the way this is used. It's all normally used like that.
Sort of a self-flagellation.
I guess so. Feels good actually, you should try it yourself.
Yeah, I'd like to.
You look like you need it.
Oh, thanks. So what have I got, a red tongue and a...
Red tongue, liver and gallbladder, tendency to frustration and anger at times, so that needs to be worked on.
Alright, I'm working on it. This is pretty good actually, can I take this home?
Well, as long as you don't use it for yourself.
So, one of the other big issues that on previous practitioners that we've had on here is taking responsibility for one's own health. Is that a big issue in traditional medicine?
Absolutely. Certainly in my practice it's really important. If someone doesn't want to take responsibility for their own health, I can't help them.
So how do you go about getting someone to take responsibility for their own health?
I educate them. And in fact I've realised over the years, over my 8 years of practice, that the most important thing I can do is give people advice. What they choose to do with that advice is up to them and their responsibility. So with Chinese medicine I know what dietary aspects will aggravate their condition, what seasonal aspects will influence their condition. Emotionally, I'll know what emotions might be involved to aggravate their particular condition. So I'll talk to them about that, and a lot of it is, you know, stress and dealing with stress and emotions of anger and frustration and worry, and they have huge impact on our bodies.
So you find a part of your role is at least is counselling?
It is,
Yeah.
and look, when I first started in natural therapies, I thought, there's no way I'm going to be a counsellor,
Yeah.
and yet I probably do that more than anything else in practice.
Do you find that being a practitioner, that it actually makes you a better person?
It does. I think more than anything, my own self-development and growth has been huge since I've been in this field, and I never thought it would be, but I believe like attracts like. So, you know, when I get 3 sore shoulders in the clinic, I think, okay, what responsibility am I taking on that I'm not handling? Or
Really?
Absolutely. I remember one stage when I was in a long-term relationship that had split up. All of a sudden I kept attracting all these women who'd split up in their relationships, or were going through divorces, or who were, you know, who'd lost through death a husband or whatever. It was amazing. Every time I go through issues, I suddenly attract women or men with those
really
issues.
Yeah. So what sort of patients are you getting at the moment?
I'm not telling, I tell you about myself. But it's true, it's amazing. It's really clicky like that. Once you start seeing the connections, they happen to you all the time.
Yeah. Yeah. Oh, that's really good. Whereabouts is your practice?
In Camberwell.
And how long have you been going there?
Camberwell only for the last 2 years.
Right.
I previously worked in box cylinder massage, tactile therapies for about 9 years. Yeah.
Do you find people, perhaps the people that you graduated with, the ones who have gone on to practice it, does it take long to build up a practice, to establish that clientele?
I think so. On average, at least 3 to 5 years. Yeah, because you need a huge base. I mean, people only come to you when they're unwell. So, you know, when they're well, which hopefully is most of the time, then they don't really need to see you.
Do you try and, with this taking responsibility for one's own health, do you try and get people to the point where they don't have to come back, basically?
Absolutely, yeah. I don't like them becoming dependent on my herbal medicine or on any nutrients that I give them. Eventually I have the intention of getting them off that and becoming self-sufficient. However, that's not always possible because we live in a society where environmentally there's a lot of chemical pollution, there's a lot of stress that people don't handle very well, so often they need something just to support them in that time.
Just perhaps a couple of rapid-fire kind of things. What about vegetarianism, personal opinion of it?
I think vegetarianism is an improvement with the way people are eating so much meat, particularly in Australia. I mean, cows are pretty abundant here and we eat a lot of meat. So going towards a vegetarian diet would be positive. However, I don't think a vegan diet is that healthy either. I certainly see a lot of people who go on a vegan diet who don't take the time out to prepare their food and look at the nutrient balance, etc., and who end up with, say, things like anemia or chronic fatigue-like symptoms 3.5, 4, 5 years down the track.
Do you get many people coming through with chronic fatigue?
Probably more than any other condition.
Really?
Yeah.
And why is that? Because mainstream medicine doesn't seem to offer any solution, or?
I think, like chronic diseases, I tend to see, and I'm sure most complementary therapists would see, after people who've gone through the whole medical merry-go-round and come to you as a last resort. So chronic conditions is very common. And in fact, in the survey I was talking about that they did, 75% of all people who seek traditional Chinese medical practitioners had chronic conditions of longer than 3 months.
And by a chronic condition, do you mean like cancer and really serious things?
No, not necessarily. Things like musculoskeletal problems are a big one with acupuncture, where they've persisted for more than 3 months. Yep.
Do you see traditional Chinese medicine going through the same sort of process that chiropractors did, you know, a decade or so ago, where they were unlicensed and just practicing, and then it became more and more of a cohesive and political body and lobbied the government for regs and all that sort of stuff?
Yep.
Is that sort of the process that TCM's in at the moment?
Absolutely. In fact, that's why the report was done, in order to help the government determine whether they should regulate the profession or not. And there's a strong case for that because, I mean, acupuncture is dangerous if it's not done properly, and there have been a few cases of a pneumothorax or a collapsed lung as a result of negligence.
Well, they've punctured a lung. And
Yes. Yep.
God,
I think there's
that's
6
amazing.
cases in Australia that has happened so far.
Wow.
Yeah.
Wow. That's pretty amazing. But on the whole, it's a very safe thing.
Yeah, although Chinese herbs can be very toxic if they're not done properly.
Really?
Yeah.
Are there certain herbs that only practitioners can get hold of?
Well, because it's not registered, anyone can actually get hold of herbs and acupuncture nails. You could practice acupuncture now if you wanted to, which is a bit of a problem.
Yeah.
But yeah, there's certainly, I mean, as all things, even vitamins and minerals, I would say, need to be taken in with care, because anything can be toxic if it's taken for long term. And I think people think, oh, because it's natural, it's safe, and that's so wrong.
Yeah, I've just speaking personally, I've found that when I want to take a complementary technique or medicine or herb or whatever, just taking it for a time and then having a rest and then taking it again keeps its effectiveness up. You know, if you just keep on going on it, it just reduces in effectiveness.
Absolutely. The body adapts to anything it's taking, and in fact, it's particularly so with medication that seems to be so, you know, benzodiazepines and heavy drugs used in medicine. After a certain time, people get used to it and then need to increase the dose. Same with natural therapies and remedies, yeah.
Okay. All right, well, we have to wind up. Can you perhaps just quickly tell us where people can get hold of you if they want to have a consultation?
Yeah, sure. Look, I'm in Camberwell, in Canterbury Road, Canterbury, or East Camberwell. I think I'm in the Yellow Pages, I'm not sure. I don't think I'd join this year, but normally they can contact me on 9888 6630.
Okay, the name of the shop, is there any signage?
It's actually a computer shop downstairs, and I work upstairs.
Oh, okay. All right, so look for the computer shop on which road?
Canterbury Road.
Canterbury Road. All right, well, thank you very much, Nicole.
Thank you.
That's Nicole Pessmer, a naturopath and traditional Chinese medicine person. So that's all we have time for this week. I hope you enjoyed the show. We'll be back next week with some more enlightening and amazing stuff. So until then, good night.